FluentEars family, welcome back to the FluentEars English Podcast, where learning English feels like real life, not a grammar test.
That's right. You're listening to episode 14C, the final part of our medical vocabulary and conversation series. We've already come a long way.
Yes. In episode 14A, we started with the foundation, medical word parts, body systems, and common symptoms. Then, in episode 14B, we learned how to use those words in real-life conversations with doctors, nurses, and hospital staff.
And now, in episode 14C, we're diving into the next stage. What happens after diagnosis? Today, we'll talk about treatments, medications, and emergency situations. You'll learn how to understand treatment plans, follow prescriptions, ask clear questions, and speak confidently when things are urgent.
This episode is part of both our real-life conversation playlist and our medical vocabulary and conversation playlist. So if you're learning English for daily life, travel, or work, this episode will give you the words and confidence you need.
All right, FluentEars family, let's jump in. Here's Chapter 6, Treatments and Medications.
Okay, imagine this. You've just visited the doctor. The tests are done, and now the doctor is explaining what you need to do next. This is called your treatment plan. It usually includes instructions about medicine, rest, diet, and follow-up appointments.
Let's do a short role play to show you how this sounds in real life.
All right, Rian, your blood pressure is a little high. I'm prescribing a tablet called atenolol. Take 1 tablet every morning after breakfast. Try to reduce salt in your food, do light exercise, and come back for a follow-up visit in 2 weeks.
Okay, doctor. So 1 tablet every morning after breakfast, right?
Yes, that's right. And if you feel dizzy or too tired, let me know when you come back.
See how simple that conversation was? The doctor gave clear instructions about what to take, when to take it, and when to return.
Exactly. Doctors often use simple phrases like, take 1 tablet once a day, or come back in 2 weeks. These are the key details you must remember.
And if anything is unclear, don't be afraid to ask. You can say, should I take it before or after meals? Or, how long should I take it for?
Those are great questions. Doctors appreciate when you ask for clarification because it shows you're careful about following the treatment.
Let's talk about some common words you'll hear in these situations. When a doctor gives you medicine, they'll usually hand you a prescription. That's the paper with your medicine name and instructions.
And the dosage is how much medicine you need and how often you should take it. For example, 1 tablet once a day is your dosage.
A treatment plan is the full set of steps your doctor wants you to follow to get better. That includes medicines, diet changes, or exercises.
And a follow-up is your next appointment to check your progress.
You don't need to memorize definitions. Just remember how these words appear in sentences. For example, my doctor gave me a prescription. I'm following my treatment plan. I have a follow-up appointment next week.
Let's do a little practice. I'll say a doctor's instruction, and you repeat it in your own words. Ready? Take this syrup twice a day after meals. You can say, I need to take this 2 times a day after I eat. Come back for a follow-up in 10 days. You can say, I'll return to the clinic after 10 days. Great job!
Now let's do another role play to show how you can ask questions politely. Doctor, should I take this before or after food?
Take it after food.
And how long should I continue?
For 1 week. Even if you feel better, finish all the tablets.
Okay. Are there any side effects?
You might feel a little sleepy, but that's normal. If you notice anything serious, come back immediately. See? These short questions make sure you don't make mistakes. You can say, could you repeat that? Or, could you please write it down? It's polite and helpful.
Yes, clear communication keeps you safe and helps you recover faster.
Let's also look at how we talk about getting better. If someone says, you're on the mend, it means you're improving. If they say, you're back on your feet, it means you're healthy again. And if the doctor says, take it easy, That means you should rest and not overwork yourself.
And if you're just a little sick, you can say, "I'm feeling a bit under the weather." That's a very natural English expression.
Let's practice one. If your friend says, "You're on the mend," what does it mean? Right. It means you're getting better.
Here's one more cultural note. In many countries, you buy your medicine from a pharmacy after your doctor's appointment. So you can ask, "Where is the nearest pharmacy?" Or, "Do I need a prescription for this medicine?"
Polite questions make everything easier. The pharmacist can even show you how to take the medicine. All right, that's everything you need for understanding treatments and medications. Now let's move on to something more serious. What to do during an emergency. Emergencies can be scary, especially when you have to speak English quickly. But don't worry, we'll show you simple phrases that can save time and help people understand you.
In an emergency, focus on 3 things. Say where you are, what happened, and what the problem is. That's enough for help to arrive. Emergency services, how can I help?
Hello, I'm at Central Park near Gate 3. A man has collapsed. He's not breathing. Please send an ambulance.
Okay, help is on the way. Stay on the line.
That's how simple it can be. Short sentences are best. He's unconscious. She's bleeding. He's choking. She's not breathing. No long grammar, just clear facts.
Let's learn a few key words. Unconscious means not awake. Bleeding means losing blood. Fracture means a broken bone. A heart attack is when someone has sudden, severe chest pain. A stroke is when blood flow to the brain stops, and the person might not be able to speak or move properly.
You don't need medical training. Just describe what you see.
What happened?
He collapsed while jogging. He's not conscious.
Does he have any health problems?
I'm not sure, but he said his chest hurt before he fell.
That's perfect. In emergencies, describe what you saw, not what you think.
What's the problem?
I cut my hand badly. It's bleeding a lot.
Come with me. We'll clean the wound and give you stitches. You might also hear the nurse say bandage, injection, or IV drip. These are common treatments in emergency care.
If you're in pain, just say it simply. It hurts a lot. I can't move my leg. I feel dizzy. I can't breathe. Don't worry about grammar. Clarity is everything.
Exactly. Short, direct sentences help doctors respond faster.
People often use idioms when they talk about emergencies later. For example, "It was touch and go" means it was very serious and could have gone either way. "They arrived in the nick of time" means just before it was too late. And "it was a close call" means something bad almost happened but didn't.
Let's practice one. If someone says, "The ambulance arrived in the nick of time," it means help came just before it was too late. Now your turn. Imagine you're calling emergency services. Say it out loud. "Hello, I'm at the train station. A man collapsed. He's not breathing. Please send an ambulance." Perfect. Perfect. That's clear and powerful English.
All right, we've covered everything from calling for help to explaining pain. Emergencies are stressful, but now you have the English to stay calm and be understood.
Yes, and that means you're ready for both planned treatments and unexpected emergencies. Okay, FluentEars family. So far, we've covered what happens during treatment and emergencies. But what about after that? What happens when you're getting better? Let's talk about recovery and follow-up visits.
Right. Recovery is when your body is healing after an illness, injury, or surgery. It's one of the most important parts of medical care, because even after the medicine or procedure is done, your body still needs time and care to fully heal.
Exactly. Doctors often say things like, "Take it easy," "Get plenty of rest," or "Listen to your body." These are all simple ways to tell you, don't rush the process.
Let's start with a quick example of what a recovery conversation sounds like in real life.
Hi, Rianne. How are you feeling after the surgery?
I'm feeling better, but the wound still hurts a bit.
That's normal. The stitches will be removed next week. Until then, keep the area clean and dry. Don't lift anything heavy.
Okay, doctor. Can I go back to work?
You can start light work in a few days, but avoid physical activity for another week.
Got it. Thank you for explaining.
See how simple that was? The patient described how they felt, and the doctor gave clear advice. Words like wound, stitches, light work, and avoid physical activity are all part of recovery vocabulary.
Yes. You'll also hear words like healing, rest, pain relief, follow-up check, and recovery time. These are easy to use in daily conversations, too.
Let's go through a few examples. The doctor said my wound is healing well. I need another follow-up appointment next week. My recovery time will be about 2 weeks. I'm taking pain relief medicine twice a day.
Now, what if you want to thank your doctor or nurse? You can say, "Thank you for taking care of me," or "I really appreciate your help." It sounds polite and natural.
And if you want to ask a question politely, you can use soft phrases like, "Would it be okay if I start exercising again? Could you please tell me when I can remove the bandage? Should I keep taking this medicine?"
These polite questions make communication smoother and show respect, something doctors and nurses always appreciate.
All right, let's practice together. I'll say something a doctor might say, and you repeat it in your own words. Keep the wound clean and dry. You can say, "I should make sure the wound stays clean and dry." Don't lift anything heavy. You can say, "I need to avoid lifting heavy things." Come back for a checkup in 10 days. You can say, "I have to return to the clinic in 10 days.
Perfect. The more you repeat these, the more confident you'll sound in real-life situations.
Now let's look at a few idioms people use during recovery. On the road to recovery means you're improving. Feeling back to normal means you're fully recovered. Take one day at a time means don't rush your healing process. Back on your feet means you're healthy again.
Here's a quick quiz for you. If someone says, "I'm on the road to recovery," what does it mean? Yes, it means they're getting better.
That's right. Recovery language is full of hope and patience, two things that help healing happen faster.
"Hi, doctor. I finished my medicine and I feel much better."
That's great to hear. Any side effects?
No, just a little tired sometimes.
That's normal. Keep drinking plenty of water and eating healthy meals. You can stop the medicine now, but come back in 1 month for a checkup.
Sure. Thanks for your help.
Notice how the conversation was short but clear. Words like side effects, checkup, stop the medicine, and come back in 1 month are all very common in recovery discussions.
And don't forget, it's perfectly okay to ask, "Is everything healing properly?" Or, "When can I return to work?" Clarity is more important than complex grammar.
Okay, FluentEars family, now that we've talked about treatment, emergencies, and recovery, let's talk about something even more powerful: prevention.
Yes. Prevention means taking steps to avoid getting sick in the first place. Doctors often say, "Prevention is better than cure."
That's one of the most famous health sayings in English, and it's true. Simple daily habits can keep you healthy and save you from many visits to the hospital.
Let's look at some vocabulary and sentences you can use when talking about health and prevention.
Balanced diet means eating the right mix of foods. Regular exercise means moving your body often. Stay hydrated means drinking enough water. Routine checkup means visiting the doctor regularly to make sure everything is fine. Vaccination means getting an injection that protects you from diseases.
Emma, you look great. What's your secret?
Thanks. I've started exercising 3 times a week and eating less junk food.
Wow, that's awesome. I really need to do that too.
You can start small. Maybe a 20-minute walk after dinner, or drinking more water during the day.
Good idea. I'll try that from tomorrow.
See? Conversations about health don't have to sound like lectures. Simple, friendly sentences can encourage others too.
Exactly. You can say things like, "You should get more rest," or "It's important to eat on time." These are polite ways to give advice.
But be careful. Don't say "you must" unless you're the doctor. It can sound too strong. Instead, use should, try to, or it's better to.
For example, "You should avoid too much sugar." "Try to sleep at least 7 hours a night." "It's better to take short breaks when working."
Let's practice turning advice into polite English. I want to tell my friend to drink more water. You can say, "You should drink more water." I want to tell my coworker to take rest. You can say, "It's better to take some rest."
Perfect. That's exactly how native speakers talk in real life.
Now let's look at some useful idioms and expressions about health and prevention. An apple a day keeps the doctor away means healthy habits prevent illness. You are what you eat means your food affects your health. Early to bed, early to rise makes a person healthy, wealthy, and wise, is a classic saying about good routines. Kick the habit means to stop doing something unhealthy, like smoking.
Here's a fun quiz. If someone says, "I finally kicked the habit," what does it mean? Yes, it means they've stopped a bad habit, like smoking or drinking too much soda.
Good morning. How are you feeling today?
"I feel fine, doctor. I just came for a routine checkup."
That's great. Let's check your blood pressure and weight. Everything looks normal.
"Thank you. Is there anything I should improve?"
Just try to get a bit more sleep and eat more vegetables. You're doing well.
"Will do. Thanks for your time, doctor."
That's exactly how a regular checkup sounds. No illness, just a quick visit to make sure everything's fine.
Yes, and these conversations are common when you're living, studying, or working in an English-speaking country.
It's always smart to know how to talk about your health, because it helps you feel confident and safe.
Let's end this chapter with a few quick review phrases. Repeat after me. "I'm here for a follow-up appointment." "The doctor said I'm recovering well." "I need a refill for my prescription." "I try to eat healthy and stay active." "Prevention is better than cure."
Beautiful. Those sentences make you sound natural, polite, and fluent.
All right, FluentEars family. You've just learned how to talk about recovery, follow-ups, healthy habits, and prevention. Everything that keeps you healthy after treatment.
Now you're ready for every part of the medical journey, from symptoms to recovery.
All right, we've now completed the full picture. Treatment, emergencies, recovery, and prevention. You've mastered medical vocabulary that connects to real life.
And that's exactly what learning English should feel like. Useful, practical, and empowering. And that brings us to the end of episode 14C, the final chapter of our medical vocabulary and conversation series.
From episode 14A to 14C, you've built a full toolkit: vocabulary, conversations, practice, and confidence.
Remember, fluency comes from using English, not just studying it. Replay this episode, repeat the dialogues, and speak out loud.
Next time you're in a hospital, you'll know what to say, calmly and clearly.
This episode is part of our real-life conversation playlist and medical vocabulary and conversation playlist. Make sure you follow them both so you can practice anytime.
You did amazing today, FluentEars family. Keep learning, keep practicing, and keep believing in yourself.
We'll see you soon in our next playlist with more real-life conversations. Till then, take care and happy learning. Bye, FluentEars family.